So some patients following LASIK or RK surgery will not have the ideal results that they were hoping for, and actually vision is not crisp and sharp because the cornea is not healing in the way that it should, and specialty contact lenses can be used in order to get the vision back to where the patient is comfortable and more functionable.
What percentage of patients are you seeing in your practice and through the literature have sort of adverse reactions or poor outcomes for initial RK and LASIKs?
Well, I would say we see quite a bit here because we're such a referral source that we definitely probably see more than the average practice. People seek us out for these complications. Overall, I don't...
Under 1%.
Yeah, it's a very rare...
It's a small percentage of all the cases, but those patients who do suffer from these complications are highly symptomatic, and also there are issues that even go into the psychology of the patient. These patients probably wore regular standard soft contact lenses fairly successfully, but just felt that, gee, wouldn't it be nice not to have to put on and take off and care for contact lenses, so let me do this wonderful surgery that I've heard so much about. And unfortunately, they had one of the rare poor outcomes. Now they can no longer see even well with glasses. They have distortions of vision. They cannot wear soft standard contact lenses because their vision is not adequate with them, and they are quite distressed. They go through psychological depression to certain degrees, sometimes expressed as anger towards the doctor who treated them, the surgeon who treated them, but sometimes that anger and disappointment is redirected inward, and patients are very sad and even depressed and blame themselves for making bad choices. We try to address that also by speaking to them and having them understand that it is not their fault, that the odds were so far in their favor that they do well, but this, as with any surgery, sometimes there are complications. And we pride ourselves in being able to address not only their vision and eye needs, but also to address some of these psychological issues, which are really important.
And what kinds of treatments do you then offer the patient? Because it's got to be difficult for them to accept the notion that they may have to wear contact lenses again when that's the reason they got the procedure.
It's
in
a
the first place,
very
right?
difficult thing, and we acknowledge that fact right at the beginning. That's one of the first things that we talk to our patients about, the fact that we understand that in essence they don't want to be here this day.
Yeah.
They shouldn't be here, they don't want to be here, and when we talk about the options to correct their vision, they are not going to be all that excited about it because this isn't really what they wanted. However, we have to move forward and address their needs so that they can function optimally. In terms of options, there are many, many different options within the contact lens area and even outside the contact lens area that can help them. And we explore all of these options and try to choose the best one for them. We have to address the fact that not only do they want to see well, but they need to be comfortable in their contact lenses. So, for example, taking a patient who originally wore soft contact lenses well and then telling them after this surgical procedure they have to wear a rigid or a hard contact lens sometimes can be difficult. So we have many different options that address those issues. Various designs of lenses, combinations of different designs of lenses, so on and so forth. And we pride ourselves in the ability to present that to our patients and give them virtually all of the options that are possible with today's technologies.